Welcome to our mnemonic video on syncope and pre-syncope differential diagnosis. Let's get started. This scene will take place in a classroom full of young students and will help us learn all about the differential diagnosis of syncope. Here we can see one student who's working on a dissection and is being quite dramatic at the sight of the specimen. As this drama queen stands, she falls back in her chair and acts as if she's fainting. Her reaction to her dissection should make you think of orthostatic hypotension, a sudden drop in blood pressure when standing from sitting, and a common cause of syncope. So fainting drama queen for orthostatic hypotension. Notice that the girl has an empty bottle of syrup next to her. She brought this bottle with her because she was worried that dissecting on an empty stomach would make her woozy. She didn't realize that in her state of anxiety, she downed the entire bottle. Now it's sitting empty on her desk and she's quite worried that she may pass out. Anyways, the syrup bottle is our symbol for glucose, and the fact that it's empty should make you think of hypoglycemia, which can cause syncope. So empty syrup bottle for hypoglycemia. Looking past our dissecting student, we can see some remnants from a party that happened in this area a few days ago. There's some deflated balloons around the bulletin board. The red balloons here represent red blood cells. Therefore, the deflated red balloons represent anemia, another diagnosis on our differential for syncope. It looks like the drama queen's plan worked. We can see the pregnant teacher making her way to call for help when a balloon popped in the hallway, which got her distracted. And now we can see her halfway inside and outside of the class. Anyway, the idea of a popping balloon and a pregnant teacher halfway inside and outside of the classroom should make you think of ruptured ectopic pregnancy, which is another possible cause of syncope. Before the teacher was distracted outside the classroom, she was doing some grading of other dissections. The dissection we can see on the table was completed chaotically, much to the dismay of the teacher. She even left a note for the student expressing her disappointment. Anyway, the word chaotic sounds kind of like aortic. Also, the red vascular-looking contents on top of the dissecting tray look kind of like the large aortic vessel. So the chaotic dissection front and center should help you remember aortic dissection. Another student is viewing the chaotic dissection and is shocked to see the amount of blood and guts. We can see him sweating, shaking, and his eyes are rolling back in his head, much like when one has a vasovagal attack. The vasovagal attack is a transient loss of consciousness secondary to a neurally mediated drop in the blood pressure brought on by fear, pain, or blood phobia, and may result in syncope. So reflex syncope or a vasovagal attack is another cause of syncope. One of the students was working on his project developing a remote control car when all of a sudden the AAA batteries he was using exploded. If you look closely, we can see why they exploded. The batteries are swollen already, much like an aneurysm, particularly abdominal aortic aneurysm, often referred to as AAA, like that on the batteries here. This idea of exploding AAA batteries should make you think of a ruptured abdominal aortic aneurysm, which is another possible cause of syncope. As the batteries explode, the remote control was shaken violently and interrupted the signals to the car. Those erratic signals, or waves, resemble the abnormal EKG waves seen in cardiac arrhythmias, which can cause syncope by interrupting the blood flow through the heart, leading to a decreased cerebral blood flow. So irregular waves for cardiac arrhythmias. In the background, more dysfunction ensues as this student breaks the faucet valve trying to get some more water. Now, the heart-shaped sink flooded, and he's clueless about what to do. So this idea here should make you think of valvular disease of the heart, which can cause syncope. So broken valve for cardiac valvular diseases. Another student has been working with spiders. If we look closely, it seems like the arachnoid is injured and bleeding that caused a little puddle underneath. We can say it's a subarachnoid bleed or subarachnoid hemorrhage because the blood is underneath the arachnoid. So subarachnoid hemorrhage is another cause of syncope. Here comes the student responsible for the spider. He wanted to check out the bleeding spider, but the spider's lamp had some troubles. As he tried to fix the problem, he was electrocuted, and we can now see him shaking uncontrollably in a seizure-like frenzy, reminding us that seizures are another potential cause of syncope. It looks like this guy is a botanist who is growing a lung-shaped tree right next to his spider tank. However, his tree seems to have a dead branch because of the rope wrapped around it proximally. The lung-shaped tree with a dead branch resembles what happens to the lung in the setting of a pulmonary embolism. The embolism blocks the pulmonary blood flow, causing infarction distally. So a lung-shaped tree with a dead branch for pulmonary embolism, which is another possible cause of syncope. And with that, we've covered everything you need to know about the differential diagnosis of syncope.